Now let's look more closely at what a bloodborne pathogen is and the definition of epidemiology. Epidemiology is the study of diseases, how they are transmitted and controlled. Human bodily fluids can carry disease-causing organisms known as bloodborne pathogens. These organisms can be identified as different types of bacteria and viruses. Bloodborne pathogens can be transmitted when blood or bodily fluid from an infected person enters another person's body via needle sticks, human bites, cuts, abrasions, or through mucous membranes, most commonly the nose, mouth, or eyes. Any bodily fluid containing blood is potentially infectious. Also, semen, vaginal secretions, and saliva in dental procedures are considered potentially infected bodily fluids. Examples of bloodborne pathogens include, but are not limited to, the hepatitis B virus, or HBV, the hepatitis C virus, or HCV, the hepatitis D virus, or HDV, the hepatitis G virus, or GBVC, and last but not least, the human immunodeficiency virus, or HIV. Although a number of pathogens can be transmitted percutaneously, HIV-1 remains the most common. The HIV virus is extremely fragile and only lasts a fraction of a second outside of the body. Hepatitis B and C viruses, however, can live up to a week on a dried surface. The most serious and dangerous disease you could potentially contract from bloodborne pathogens is the human immunodeficiency virus, commonly known as HIV. Once someone contracts HIV, the potential for developing acquired immunodeficiency syndrome, or AIDS, is very high. AIDS is no longer a problem in just isolated sexualities or cultures. The disease is not blind to any culture or demographic. HIV directly attacks the human immune system. A healthy human body can actually carry a lot of different germs and infections, but it's our immune system with white blood cells that fights off diseases by carrying these pathogens and other toxins from our cells to the liver for proper removal and disposal. When that system is weakened, we simply lose our ability to flush our systems from these toxins and pathogens, and we become sick. Good hydration and a proper diet, rest, and exercise contribute immensely to the strength of your immune system. In the early stages of HIV, patients experience a condition similar to mononucleosis. As it progresses, flu-like symptoms begin to occur, such as fever, rash, diarrhea, sore throat, nausea, and headaches. In observing a person with HIV or the more progressed AIDS, you will also see more specific signs that can indicate the disease. These specific signs and symptoms are as follows: persistent lymph node swelling, fever or diarrhea that lasts more than a month, rapid weight loss for no apparent reason, infections of the nervous system, pneumonia, persistent cough, and the appearance of bluish-red cancers under the skin. Fortunately, when the virus is outside of the human body, it has a lifespan that is short-lived and cannot survive for more than a fraction of a second. The concern is direct contact with HIV-tainted blood or other body fluids through person-to-person contact, such as a needle stick, blood transfusion, or sexual intercourse. Today, there is no cure for HIV or for the more advanced stage, AIDS. It can sometimes be managed by medication, but ultimately it leads to death. Viruses that primarily attack the liver are called hepatitis viruses. People can carry these viruses without realizing and pass the disease along to others. Some may experience delayed symptoms, making them virtually unaware that they carry the virus. Hepatitis virus is easy to contract and highly infectious. In the early stage of any hepatitis strain, known as the prodromal phase, which begins approximately 2 weeks after exposure, flu-like symptoms appear and can last for months. In this phase, symptoms such as fever, chills, night sweats, headache, malaise, anorexia, nausea, vomiting, diarrhea, and abdominal pain are common. In the second stage of the disease, known as the icteric phase, swelling of the liver and jaundice, or yellowing of the skin, white of the eyes, and nails sets in. And once a person is infected, the virus becomes a permanent part of the gene structure of the liver cells. Other symptoms include darkened urine, clay-colored stool, and intense itching. In the third stage of the disease, known as the convalescent or recovery phase, patients experience weakness, malaise, and a gradual decrease of symptoms. Even though the patient may start to feel better, they must still be resting and avoid any extraneous activities until they are fully recovered. A patient's compromised immune system often doesn't have the ability to fight off the advancement of the disease, and cirrhosis of the liver and liver cancer can occur after coming down with the disease. So how do you get it? The truth is, almost anyone around a medical, dental, or any other healthcare environment is at significant risk for hepatitis. It comes from infected blood, contaminated needles, syringes, blades, sharp instruments, or even blood that is found in urine or feces. It can also be carried in saliva, semen, vaginal secretions, breast milk, and simple personal contact. And there's absolutely no way for you to determine the type of person who might or who is likely to have the disease. This is why you should always exercise universal precautions, which assumes everyone is infected. What are the common types of viral hepatitis? Although hepatitis A is not considered a bloodborne pathogen, this strain accounts for an estimated 1,781 new infections per year, according to the most recent Center for Disease Control and Prevention, or the CDC data. Infection with HAV can be spread through the ingestion of food or water, especially where unsanitary conditions allow food or water to become contaminated by human waste containing hepatitis A virus. HAV typically is spread among household members and close contacts through the passage of oral secretions during such activities as intimate kissing or human feces due to poor hand washing. It is also common to have infection spread to customers in restaurants and among children and workers in daycare centers if hand washing and sanitary precautions are not observed. There were more than 19,000 new cases of HBV infection in 2013, and more than 1,800 people die each year due to the consequences of chronic hepatitis B infection in the United States, according to the CDC. HBV is a bloodborne pathogen and can spread by sexual contact, the transfer of blood through shared needles in drug abusers, accidental needle sticks with needles contaminated with infected blood, blood transfusions and hemodialysis, and by infected mothers to their newborns. The infection can also be spread by tattooing, body piercing, and sharing razors and toothbrushes. About 6 to 10% of patients with HBV develop a chronic HBV infection, which lasts at least 6 months and often years, and can infect others as long as they remain infected. Patients with a chronic HBV infection are also at risk of developing cirrhosis of the liver, which can result in liver failure and liver cancer. It is estimated that there are 2.2 million people in the U.S. and 2 billion people worldwide who suffer with chronic HBV infections. Like hepatitis B, HCV is also a bloodborne pathogen, and the carrier may remain unaware of the hepatitis C virus being present in his or her system and spread the disease to others unintentionally. Unfortunately, there is currently no vaccine for hepatitis C, but the disease can be cured with the latest medication that has recently been discovered. The CDC reported that there are about 16,500 new cases per year of hepatitis C. HCV is usually spread by shared needles among drug abusers, blood transfusions, hemodialysis, and needle sticks. In 2006, the CDC reported 3.2 million people were infected with chronic hepatitis C, and 80% of those infections have not manifested symptoms and may not for months or even years. Approximately 90% of transfusion-associated hepatitis is caused by HCV. Transmission of the virus by sexual contact has been reported, but is considered rare. An estimated 50 to 70% of patients with acute HCV infection develop chronic infection. Patients with chronic HCV infections can continue to infect others and are at risk for developing cirrhosis of the liver, which can result in liver failure and cancer. It is estimated that there are about 3.2 million people with chronic HCV infections in the U.S. The symptoms from all strains are fatigue, abdominal pain, loss of appetite, jaundice, and vomiting. The precautions you will learn about in this training regarding protecting yourself from these diseases apply to all 6 strains, except for the precaution of vaccination. There are also viral hepatitis types D, E, and G. The most important of these at present is the hepatitis D virus, or HDV, also known as the Delta virus or agent. It is a small virus that requires an existing infection with HBV to survive. HDV cannot survive on its own because it requires a protein that the HBV makes to enable it to infect liver cells. Minimal information is known about hepatitis D, except that some people will die from the disease after a brief period of time, while others fully recover and continue on living with the hepatitis B virus. Some people develop chronic hepatitis D and live with the disease for the rest of their life. The ways in which HDV is spread are by shared needles among drug abusers, contaminated blood, and sexual contact, essentially the same ways as HBV. Individuals who already have chronic HBV infection can acquire HDV infection at the same time they acquire the HBV infection, or at a later time. Those with chronic hepatitis due to HBV and HDV can rapidly develop cirrhosis, or severe liver scarring. Moreover, the combination of HDV and HBV virus infection is very difficult to treat. Similar to HAV, HEV is not a bloodborne pathogen in terms of disease, and mainly occurs in Asia, where it is transmitted by contaminated water. Following the identification of hepatitis A and B viruses, it was apparent that additional hepatotropic viruses existed. Continuing study led to eventual confirmation of hepatitis viruses C, D, and E. However, after these 5 viruses had been described, additional cases of hepatitis that were also apparently caused by hepatotropic viruses were still occurring. One putative virus, seemingly found in the stool of patients with clinical hepatitis, was called hepatitis F virus. This virus was never confirmed, and subsequently an agent called hepatitis G virus was described. Hepatitis G virus, or HGV, also termed GBVC, was recently discovered and resembles HCV, but the virus and its effects are under investigation, and its role in causing disease in humans is unclear. You have the right to be offered the hepatitis B vaccination series of 3 inoculations, to be paid for or provided by your employer at no cost to you, and at a reasonable time and place by your employer within 10 days of your presence in the workplace. You may accept or decline this offer at your own discretion. If you accept this offer, you must begin the first inoculation within 30 days from the date of acceptance. Otherwise, the employer is no longer obligated to pay for the vaccine. The law also requires that you receive a post-vaccination test or a titer test. This test should be conducted within 30 days following your last shot in the 3-shot series. The reason for this test is to ensure that the antibodies of the vaccine are at a level that will render you immune from the virus. If the titer test reveals less than minimum levels, the series of shots needs to be repeated. The decision to repeat the vaccination is at the sole discretion of the employee. This vaccination is made from a yeast culture, so if you're allergic to yeast, you must alert the doctor before the inoculations begin. You may decline to receive the vaccination and change your mind at any time in the future, but you must sign a hepatitis B consent and declination form in either case. Your employer is responsible for maintaining these records. Also, remember that you are not required to show proof of vaccination to your employer in order to decline the offer. The consent form indicates that your employer is offering the vaccination at no cost to you and is in full compliance of this requirement. Please remember that you, as an employee, have up to 30 days from the date of signed consent to begin the first series of your vaccines. If there is an incident in your workplace and you're exposed to infectious materials, you must have the opportunity to leave your facility within 2 hours to receive post-exposure testing. During this time frame, your employer must pay for your time and all expenses associated with the testing. The records manual, available on your online portal, provides a form for employers to use when an exposed employee refuses to seek post-exposure evaluation care, entitled Post-Exposure Evaluation and Follow-up Form. You and your employer must also be provided with a post-exposure medical evaluation from the treating physician, and you both must receive a written report documenting the results of that evaluation within 15 days of the completion of that evaluation. Once the results are received, the safety coordinator must fill out the post-exposure evaluation and follow-up form. The doctor or designated healthcare provider must review the details of that report if you ask for a personal explanation. The information in these reports is confidential and cannot be given to anyone else without your permission. Your employer is required to maintain a copy of the post-exposure evaluation at your facility under lock and key in your personnel file. The healthcare provider must also give you a written opinion as to whether a vaccination is recommended or if a follow-up evaluation is required. It is recommended by healthcare experts that you receive a titer test for the hepatitis B vaccine if it has been over 10 years since your vaccination series. The reason for this test is to see if the vaccine is still present in your system. If the results show that the vaccine is below minimum thresholds, a booster shot is required to reach the minimum level of immunity and must be paid for by your employer. If the test reveals a negative reading, meaning that you are not immune, you now have the option to get re-vaccinated at your own expense if desired. If the titer test results are negative, it is recommended to wait a couple of months, repeat the test for validation, because the individual hormone levels will affect the results.